What are the precautions like an IT worker should do to prevent noise-induced hearing loss with headphones?
3 things they need to remember for sure. Number 1, following the 60-60 rule. Keep the volume on your gadget, on your mobile. Number 2, creating an optimal workspace. That's very, very important.
Which one do you prefer, over-the-ear headphones or in-the-ear headphones?
I prefer.
Do you see a lot of patients with increased hearing loss these days compared to before?
Many.
In elderly people, the other big thing is hypertension and diabetes can lead to hearing loss, right?
Yes, sir. Protection device, earplugs, ear defenders. They passively block and at the same time they have this active noise cancelling feature also in case if you want to use them.
Hearing loss only affects elderly people.
That's a myth.
It affects everybody.
Everybody. The hearing which is gone, the precious hair cells that are gone once cannot be restored.
Hello guys, this is Dr. Pal Manikam, gastroenterologist focused on your gut health. Welcome to another episode of Gut Feeling with Dr. Pal. In this episode, we're talking with Dr. Shree Rao. She's one of the reputed cochlear implant surgeons. There are only a handful of surgeons in India. I had this opportunity of talking to her about the most possible epidemic in India right now, which is noise-induced hearing loss. Noise pollution has been going on throughout with the advent of newer headphones, work from home culture, and a lot of computer meetings and everything. We are being exposed to a lot more decibels than our ears can handle. So she went through how we can identify what are the treatment options available, how we can prevent it with simple steps, and more importantly, she is such a good soul that she works at Dr. Rao Hospital at Hyderabad, where they are placing cochlear implants in people who cannot afford this, and she's doing as a wonderful cause for a part of a non-governmental organization as well. I had a blast in this episode. I'm sure you will learn similar to how I did. Let's dive deep into it. So welcome, Dr. Shree. You are one of the most reputed cochlear implant surgeon. I'm so happy to have you in my podcast. I really want to drill down on this condition called noise-induced hearing loss, which is, I'm going to explain that to my audience in a brief as well. So since COVID, everybody is on earphones, earpod, you name it, okay? And then, I don't think they understand the purpose of the Zoom meet, but they will make sure that they mute the Zoom call. So many people are on the earphones. And recently, I came to know that, Alka Yagnik?
Yes, sir.
Right? And then she raised a beautiful awareness that, noise-induced hearing loss of this frequent use of headphones is one of the reasons as well. So tell me why this is happening and walk us through why frequent use of headphones might be a problem.
First things first, sir, noise-induced hearing loss, as the name itself suggests, it's because of prolonged exposure to noise, which leads to hearing loss. This is how we tell it. And why is this exactly happening? Let me tell you how actually the hearing functions. Our ear is divided into 3 parts: outer, middle, and inner. Sound travels from the external ear and it causes vibrations. And these vibrations set the eardrum. We call it as tympanic membrane. Cause vibrations. And these vibrations are transferred to the middle ear. In the middle ear, they have some tiny bones, 3 bones. From the middle ear, because of the vibration of the ear bones, they travel into the inner ear. In the inner ear, we have a major organ called the engine, the cochlea.
Cochlear.
This cochlea, it has very tiny hair cells. And these hair cells, the function of these hair cells is to convert this sound waves, the mechanical vibrations, into electrical impulses. And these electrical impulses are sent to the cochlear nerve or the hearing nerve, auditory nerve. And they are sent to the brain. And there it is perceived as speech. Now, what happens is noise-induced hearing losses.
Let me boil it down a little bit so that everybody can understand. So somebody is speaking and that sound is going into the ear, auditory canal, and then it goes inside this cochlea, which is the engine deep in the ear.
Yes, sir.
Which is the inner part of the ear.
Yes, sir.
We call that as the inner ear.
Inner ear.
Okay, so that sound impulses, what does this cochlear engine do? It converts that into an electrical
impulses.
And it gets to your brain.
Yes, sir. Through the nerve.
Through the nerve.
It's like a wiring.
Through the wiring.
Through the
Okay.
wiring, it is conducted into the brain. Inside the brain, it is processed as speech.
Speech. So somebody is
Speech.
talking to you.
Yes.
Ah.
Yes.
So then the brain interprets as a language
Yes.
that you
Yes.
know or you may not know.
Yes.
Okay.
So, what happens in this noise induced hearing loss? There is continuous exposure of sound. So, continuously the ear bones are vibrating.
The
And
tympanic
continuously,
membrane.
eardrum vibrating. And from eardrum vibrating, the bones are also moving. And from there, the hair cells, as I told you, within the engine, it's continuously acting. So, they come to a stage where they no longer work. It's like using a muscle every day to train and all of a sudden gives up. So with this, the sound waves, they are continuously triggering the hair cells. So they go into a state of metabolic exhaustion and oxidative stress due to prolonged exposure to sounds, causing the death of the hair cells.
So hair cells are so tiny, correct?
Yeah, exactly, sir.
And even the engine itself is so small, right?
Yes, sir.
What is the size of it in general? I mean, if you want to compare, it's like a size of a small button or the size of a golf ball.
Extremely tiny.
Extremely tiny.
Extremely tiny. We have to literally use a microscope to see the turns of it. It's in the form of a snail.
And then I know that there are multiple semicircular canals.
Yes.
It-
Within the inner ear,
Inner ear.
it has a cochlea, the anterior part, which is responsible for our hearing, and the posterior part has semicircular canal, like the Lord of Rings.
Correct.
That is responsible for balance. So our ear is not just responsible for hearing, but also for the balance. I, being a hearing restoration surgeon, my focus will be more on this cochlea, the front part, because the cells, once they are died, there is no way that we are going to
can
get
come
back. No.
How many cells will be there? Like
There-
millions?
Sir,
Millions of cells?
there will be almost 3,000 to 4,000 of inner hair cells and almost 12,000 to 13,000 of outer hair cells. Only these many. That's all. It's
So,
like diamond, precious
I
diamonds.
see. Wow. So everybody is born with it.
Yes, sir. Everybody.
Which is more important, inner or outer? I mean, given an option.
Obviously the engine, sir. Because
Engine.
some people, they do not have any ear at all. We call it atresia. They don't have, but still they'll be able to hear because they are hearing through the engine.
So that's a very important point. Atresia is few babies will not have ear at all.
Yes.
When they are born, they will be born earless.
Yes. But in spite of which, they'll be able to hear
Correct.
when the inner ear, the hearing organ develops.
Correct.
There is a fascinating thing which I can tell you because I think most of the Indians do know about it. In Mahabharata, Abhimanyu, when he was in his mother's womb, Subhadra Devi's womb, he completely overheard whatever Arjuna was narrating about the Padma Vyuham to Subhadra. Even in spite of Subhadra Devi, she slept. In spite of which he was able to hear inside the womb. And that is true. Because the entire hearing organ, the cochlea, the engine, the hair cells, everything it develops within 5th month of pregnancy. It's not that after the baby is born, your hands are elongating, your legs are growing, your neck is growing. It's not. The size of the inner ear, it remains constant at the time of birth till the time of death. It's only the hair cells, as age progresses or because of prolonged exposure to noise, they are dying. But they remain the same. I mean, from the time of birth, they remain the same.
Wow. I still remember the Abhimanyu story. I used to tell my kid when my wife was pregnant. I used to talk about gut health, intermittent fasting, and that's why now he's not talking to me at all. He said, "You're boring already."
He knows everything.
He knows everything. But I strongly believe that's true, correct?
True,
so
sir.
People, even as a baby inside the uterus, they can hear what you talk.
Exactly. That's why they recognize mom's voice, father's voice more. And that's why when they startle or cry loudly, whenever they hear to these voices which are already familiar with them, they tend to calm down. This is because they start hearing as soon as they are in the mother's womb from 5th month.
Wow. You know, the way that you are explaining, I could see how you are passionate about this medicine thing. I mean, your expertise. But also at the same time, it kind of raises an alarm that we only have 4,000 cells.
Totally 12,000 plus 3,000, 3 to
3,000.
4,000.
Correct.
So somewhere around 17,000 cells.
17,000 cells.
Yes.
But the more important thing, the engine one,
Yes.
which is
within the
your
engine.
3 to 4,000 hair
Yes.
cells. So that raises an awareness where we need to preserve it as much as possible.
Exactly.
So for example, I'll take it myself. Since COVID, I used to do like Zoom video consultations for my patients in California, where I used to use my headphones.
Yes.
So if I understand right, so the electronic impulses carry from the headphones all the way into the auditory canal, reach this tiny, teeny little thing at a particular frequency. Correct? What are the precautions like an IT worker should do to prevent noise-induced hearing loss with headphones?
For all the professional headphone users and people who are working remotely, for all the software engineers, and as you said, IT people, 3 things they need to remember for sure. Number 1, following the 60-60 rule. Keep the volume on your gadget, on your mobile, to only 60% of the maximum volume and limit it to only 60 minutes. And immediately after that, take a break for about 5 to 10 minutes. This way, we can avoid noise-induced hearing loss. Number 2, creating an optimal workspace. That's very, very important. Make sure that you do not sit near a window where there is so much of noise or a door where there is so much of noise. And try to incorporate certain curtains or rugs or carpets
To absorb the sound.
to absorb the sound. Creating this optimal workspace is very important. And most importantly, number 3, invest in good efficient headphones. I would say active noise cancelling headphones. And I prefer usage of telling them to use over the ear rather than in the ear headphones.
So which one do you prefer, over the ear headphones or in the ear headphones?
I prefer over the ear headphones because there are very high chances when you start using in the ear headphones. Some people may be having psoriasis or eczema, dry skin, and some of them may be having wax. And when you remove that, in fact, when you start using any earpods, you can see after a couple of days wax getting stuck there. And unknowingly, those microphones, they get blocked. So you tend to increase the volume to compensate it. That's why we say, especially I being a surgeon, after surgery, they're not supposed to use much of this one for about 3 months. And once they start using this over the ear, they enjoy that.
I see.
It snugly fits around and the natural way of hearing will be maintained.
So you said 60-60 rule, like 60% of the maximal volume, and you listen for 60 seconds.
60 minutes.
60 minutes.
60 minutes.
All right. So you said 60-60 rule, which is you 60% of the maximal volume up to 60 minutes, and then you take a break for 5-10 minutes.
Yes, sir.
But how is it practically possible? The reason is people are just like blasting their ears with, that's how the music is as well, correct?
Exactly. But the hearing which is gone, the precious hair cells that are gone once cannot be restored. We need to remember that it's like a precious diamond and we are losing. At least diamonds we can buy. But this one, later if you increase the volume to more than normal also, you will not be able to hear. It's like if you keep a loudspeaker permanently in your ear, like using a hearing aid. Rather than that, prevention is much, much better.
Wow. I'm going to be very honest with you. I grew up here. I went to US for my higher education. When the first thing that I couldn't even adapt to the US culture is the complete silence. There is no fan, okay, and there is no honk, car honks, nothing outside. I thought I was in a haunted house. It looked very silent, right? So I'm there for like 15, 16 years now. So now, I'm traveling frequently back and forth to India and US. In India, when I'm coming here, the roadside noise and in general, the utility of and other vehicles and other things, what is your take on noise pollution here in India?
I can say our country, India, is already in a kind of hearing health crisis because we are constantly getting exposed to sounds over 85 decibels. Now, let me put it this way. As per World Health Organization, WHO, the safe permissible limits of hearing is hearing about 85 decibels of sound until 8 hours in a day. So what this 85 decibels corresponds to? The normal conversation that we have in this silent environment will be somewhere around 60 decibels. Sound is measured in decibels. So this is 60 decibels. This is very normal, very good, pleasant for our ears. The sound that we are exposed in traffic, especially loud traffic, between 85 to 90, and the sounds for a hair dryer, which every woman uses nowadays, is about 90 decibels. And the sound that corresponds to a mixer blender, every homemaker uses it. That is also 90 decibels. And the sounds that we hear at concerts or loud
IPL
places,
match.
that hits over 100 decibels, above 100. And that amount of sound, 100 or 110, the safe time of exposure for that is only 15 minutes. That's why it is not possible for us practically to stick to this 85 decibels for about 8 hours in a day. You tend to put a blow dryer every day.
Correct.
You go for a salon, you get your professional hairstyling done. You have fruit juice every day with the help of a blender. All these are the loud sounds. So how to actually cut it down? Now here comes the role of a 3 decibels rule.
So you say, so how to prevent this hearing loss? Is that what you're saying?
Yes, sir. Run a day in this hectic, noisy
see.
pollution areas.
So in the midst of this active noise pollution, what are the steps that we can take to prevent this loud exposure to us?
Here comes the 3 decibel rule. What this states that for every 3 decibel increase in the intensity of sound, the safe time of exposure of sound is halved. For an 85 decibel sound, the safe time of exposure limit is 8 hours. And for 88 decibels of sound, it is only 4 hours. For 91 decibels, it is only 2 hours. And imagine in concerts, 100 decibels, the safe time of exposure is only 15 minutes.
Oh my God.
So understanding this crucial relationship between the sound intensity and the safe time of exposure is very important, especially for people of this generation where they are exposed to noisy pollution every day.
Do you see a lot of patients with increased hearing loss these days compared to before?
Many. And most of them, you'll be surprised to know, are belonging to the teenage group and young adults.
Wow. What is the
Maybe
youngest
25.
age that you have seen? What is the youngest age that you might have seen?
12 years. 12 years with noise-induced hearing loss.
Wow. 12.
And even they don't even have any symptoms. They don't even tell. They say that I'm hearing very normally. There's no problem with my hearing. The only complaint, they say that I can hear something buzzing on and off in my ear. That's all. And
Like
that
a
too, they
ringing
don't.
sound, ringing sound in the ear.
Yes. And that too, those kids, they do not know that this is not normal. So their parents, they just get it for a hearing check, and that is when they come to know.
So how do the parents identify in that 12-year-old kid?
They complain some ringing sounds. Ringing sounds very often. Some mosquito is there inside my ear. It is ringing. They usually complain of some foreign body. Something is stuck here. It is ringing continuously. See. And parents try to look into that. There will be nothing. That is when they get, okay, there should be some wax. That's why we got our child. And we say, no, there is no wax. Let us go for a hearing check. And it will be a very classic dip in the audiogram.
Oh my God. Wow. I mean, the information that you're telling me is mind blowing, because let's say I'm an average user. I'm an average headphones user. So easily anybody in an active work environment, you'll exposed to get 85 decibels easily for 8 hours. 85 decibels is very minimal. I mean, not minimal. It's a common exposure you're talking about, correct?
Yes, sir.
So you're saying just me and you talking itself around 65, 70 here. This is a very quiet room.
60.
60, quiet room.
Yes.
And so let's say I'm in active work for 8 hours and I come back, and then usually I do my in the ear AirPods and then go to the gym and then work out. And the more louder it is, the better the workout is my suspicion. That's what many people do.
Yes, sir.
Many people just completely max the volume. So then you are saying that when you increase the decibel, then the time of exposure should decrease.
Harmed.
So I have also used maximal volume before, which means that I should not use this more than like 15-20 minutes.
Exactly, sir.
Wow.
Exactly.
Wow.
In case if you're, if you really want to hit that dopamine, if you want to really work out that way, then you cut down the sounds that you're hearing at the end of the day. At the end of the day, we come home, we chill with our kids, and they tend to increase the volume in the TV. And we doctors, especially, we think we are the safe people. I definitely get exposed to nearly 85 decibels. I very clearly know that because I stay most of the time in the OT. There'll be HVAC, there'll be laminar flow, there'll be suction machines.
Correct.
Everything produces noise.
Correct.
So I'm literally placing myself there in that zone. Over the top of it, the drills that I use, it definitely corresponds to more than 85.
Got it.
So how do we, all the professional people, take care? By understanding this relationship.
Wow.
So I have completely used my safe amount of exposure there. So I have to cut down the sounds.
And there will be some few unavoidable circumstances as well where, for example, there's a temple function outside and there's a huge loudspeaker. And the second example is, during Diwali. And I'm proud that actually Tamil Nadu government has imposed a ban that you should not have firecrackers after 7 p.m. I guess.
Yes, sir. After 7.
Same in your state as well?
No, sir. It's not
It's
limited
not imposed.
that way.
Don't worry about it. It's only imposed, but nobody's practicing. But all those firecrackers, that will be easily 100 decibels, correct?
More than 100.
More than
110, 120. But all these are unavoidable circumstances. How can we quit the family functions? How can we quit our own festivals?
Correct.
So there are certain protection rules that we need to follow so that we come under that safe zone.
Right.
If we follow this, we'll be in the safe zone. Or else, we'll be having a loudspeaker at the end.
Wow. So let's say that, I hear a hearing sound, I come to you. What is the first step that you do? How do you diagnose that I have hearing loss?
When a person comes with hearing loss or when a person comes with ringing sounds?
So let's say I as a patient come to Dr. Rao's hospital and then I say that I have a ringing sound and then you assume you're suspecting hearing loss. So what do you do for the first thing in Dr. Rao's hospital?
So when a person visits to us complaining of hearing loss or complaining of ringing sounds in the ear, these are the most common things that we see every day in our common practice. We first take a very brief history, whether there was some noise exposure.
So you ask them whether you use headphones? I'm asking you.
Yes, sir. We ask them. Or sometimes they would have gone to the concert the previous day. Or they would have gone to a birthday event or some sports event. So that's why history tells us almost 50 to 60% of the rough cause.
So tell me an interesting case that you've seen with this kind of an history.
There are many interesting cases, but the one that is very closest to my heart very recently is a adult. He's 42 years old. He just had a history of dengue. That's all. And how do we normally treat it? Just we ask them to take certain medications, get admitted in a hospital.
Dengue
check
fever.
the dengue fever. Check the platelets. Everything was okay. At the time when he was about to get discharged, they said that the values were not there. Suddenly, they were not good. That's why he was placed there. And suddenly, he went into a syndrome called dengue hemorrhagic shock syndrome. And he was placed on a ventilator. All this was completely medical and nothing related to
ENT,
hearing
right,
or ENT. And all of a sudden, when he recovered from that ventilator, when he came back, he realized that both his ears were not working. He completely lost his hearing. And he's the spine of the family. He has his kids. He took loans, many loans to pay. And suddenly, he's not hearing. He lost his job, and he waited for a couple of days, and then he consulted an ENT surgeon. They gave hearing aids, but which were of no use. And then he understood that there is no way that I'm going to get this back. He wanted to commit suicide, and he committed suicide thrice for this. What happens with this dengue is we have a limited window of opportunity where we need to intervene immediately, or else it lands up into ossification, the entire inner ear. That was happening inside him. So many people were not even attempting to go ahead with surgical procedure because it's already set in the ossification. And that is when he visited us. I took him up for surgery. He was crying all the time before surgery. No, I lost my hearing. Now there is no one who is going to give
and
me
the
anything.
hearing loss is because of the dengue fever itself.
Exactly.
So dengue can cause
Dengue,
various
meningitis.
infections.
Yes, infection of the brain. So finally we did an implant surgery, and immediately at the time of switch on, he was extremely happy that, this is, I can say it's kind of Brahmastra, these kind of surgeries, cochlear implants, Brahmastram on the profound hearing loss, where people cannot even use a hearing aid. They're losing their hearing completely.
Wow.
There are many kids that I do, but this person, he's the bread maker of the family. He is who's the spine of the family. And without him earning, nothing will be there. So this has a very profound impact on the family, but it is completely hidden. At least some physical deformities like loss of hand or limbs, blindness, they can be seen. But this is completely hidden. And if he's not understanding, they call you dumb fellow, you do not understand. But they have to understand that he's deaf. That's why he's not able to hear. So this is one that is very, very closest to my heart. Of course, there are many kids who lost their hearing over a period of time, as I told you earlier, where there was a child blunt trauma.
Correct. So we talked about hearing aid, we talked about cochlear implant. Anything else that can be done?
There is something called gene therapy, which is quite fascinating now. Gene therapy is an advanced technique where doctors or scientists are trying to fix or repair the faulty genes that are responsible to cause diseases. So we are targeting the diseases, treatment of diseases at the molecular level itself. Before they manifest, before they produce any symptoms. It's just very simply to put this, how the software engineers, they try to fix a bug or a glitch in the software program to run a computer smoothly. Similarly, scientists are trying to fix the glitches in the genes so that the entire human body works normally. And this gene therapy was very recently given in a toddler from UK in an ear when she was born completely deaf. And after this infusion of gene therapy giving in her ear, she's able to hear absolutely normal.
Wow. Available in India?
It's still in the phase 3 of the clinical trials. Maybe a decade or 2 decades it takes.
Nice.
But it's
active research going on.
Yes.
So I want to know about that cochlear implant a little bit more, because I know that there are only like single digit surgeons are doing this and you're one of them. Actually, our country should be very proud to have surgeons like you, because this is a very, very niche area. And I want you to explain to our audience, what is cochlear implant in terms of some figurative devices? I know it's a very, very tiny, teeny thing.
Previously, for severe hearing loss, we had this option of using a hearing aid, a big device which has a microphone and it has a speaker kind of thing, so that it just amplifies. It's a loudspeaker kind of thing. But the problem came where there is something called profound hearing loss, where the engine, the cochlea that I was talking about, there is no residual hearing at all, no hair cells which are there. So there is no way that this hearing aid started working. And for them, this cochlear implant is a device. It's like a Brahmastram on deaf, what we call profoundly deaf individuals. It has two parts, the external part and an internal part. Internal part is the part that we as cochlear implant surgeons, we place it beneath the scalp. And electrode array, it has an array, electrode array, which will be threaded into the inner ear.
Wow.
It's like a wire that we are threading in the inner ear. And the external part, whatever it has a microphone to grab the sounds and a processor. Why a processor is required here? Why can't just an amplification device like hearing aid work there? Because in normal cochlea, as I said earlier, cochlea has hair cells. These hair cells, they transform this sound waves into electrical impulses. That is a processing unit. We already have an inbuilt, wonderful, natural processing unit. Now that is not there for this profoundly deaf. So, scientists have invented in such a way that there is a processing unit which is outside. The sound waves, whatever are being trapped, are being converted into electrical impulses within the processing unit, the speech processor. And from there, I already placed inside a device surgically. From there, the impulses, electrical impulses are conducted into the cochlea. And there, the electrodes which I threaded into the inner ear, the wire that I threaded inside, it directly stimulates the hearing nerve. So literally we are bypassing all the parts in the ear. We are even bypassing the engine, that is a processing unit inside. And
then
it's
go
like
directly into the
it's like communicating directly with your brain.
brain. Wow. And the success rate is
Tremendous.
Tremendous. Wow. And what will be the first reaction of a patient who can hear after a long time?
This is mostly done in kids who are completely born deaf.
Wow.
So what will be the first reaction of a child? As soon as the baby is born, he starts crying. The same thing will be there when we switch on the implant. They start hearing sounds and they start crying.
Wow.
That, I think there are very few moments where parents also cry or they feel happy when their kids are crying. One such moment is when we switch on the implant. Kids will be crying, but these parents, they have that Ananda Bashpal. They have that happiness. Oh my God, my kid is hearing for the first time in his life.
Wow. And of course, the satisfaction that you have from this process.
Immense. It's extraordinary.
Extraordinary, right? And so you're telling me that anyone with a hearing loss can hear back again with this cochlear implant?
There are certain criteria where we can do implants, but any age group, from a newborn baby to an elderly age group, there is no age restriction. As I told you, the cochlear develops as soon as the inner ear, it develops within the mother's womb itself. So there is no way that is increasing or decreasing in size. So it's universal.
Well, it's a breakthrough research in medical practice.
Exactly.
How long the practice has been going on?
Almost since 1980s.
1980s.
1980s they have started it, but it was in 2000s when after 2000, 2006, 2010, that is when it picked up its pace. They were slowly transforming how the processor is going to work, getting a natural hearing. They incorporated AI into that so that now in the noisy, in a sound normal, this kind of environment, they can hear impulses. But once they get into the school, there will be multiple noises which are there. So to incorporate that, they have incorporated AI in the speech processor. So it immediately transforms that that way.
Wow. It's mind-blowing. And thank you so much for doing this wonderful, noble thing. And more important, we talked about the kids. So tell me something about deafness in kids and in newborns.
As I told you earlier, surprisingly, 70 to 80% of the causes of newborn hearing loss will be genetic. There is a very significant role of genetics there. And
genetic
of course,
is, if the family history of deafness.
Yes,
mom,
when there
dad.
is a consanguineous marriage.
So consanguineous marriages or marriage between first degree relatives, which you are marrying between a sister's daughter or with mama, that relative, that angle where there is increased risk of, I know that there is increased risk of birth complications. So deafness is one of them.
Yes, it's also one of them. So this consanguineous marriages, as I told you, and a family history of hearing loss, they are all the high risk category. And as I told you earlier, once again, because within the pregnancy itself, 5th month of pregnancy itself, the cochlea is developing. So any kind of infections until 5th month or 6th month of pregnancy, the inner ear is not going to develop maternal infections like torch infections, toxoplasmosis, rubella, cytomegalovirus, herpes in case if mom is getting. The inner ear within the child is not developing. So that is also one of course.
So any infection in the mother during pregnancy.
During pregnancy, maternal infections. And that's the reason we ask them to have a very good healthy pregnancy. And in case if there is healthy pregnancy, but immediately after the birth of the child is not crying because of hypoxia. Hypoxia is the state where enough amount of oxygen is not delivered to the brain and the hearing organ for few minutes. And that also causes hearing loss. And in case all these are okay, but child develops jaundice, neonatal jaundice. Parents very clearly say, everything was okay, but child had jaundice. That's why he was kept in NICU for 1 or 2 days.
2 days.
2 days. After that, everything is okay. But that is a triggering factor because jaundice, when the bilirubin levels are high, they cross the blood-brain barrier. And that affects the hearing organ. So jaundice is the one, apart from genetics, the ones which I have seen for mother who had healthy pregnancy, non-consanguineous marriage. Jaundice is the leading cause for hearing
So
loss.
as a mother, how do we identify that possible deafness in my kid?
This is very, very important for all the expecting mothers and parents to be, because in India, a newborn hearing screening is not happening. Newborn hearing screening is happening in all the developed countries, but it's not happening in our nation because it's a developing country. So it is very important for all the parents to know certain milestones. We call this as hearing milestones. Number 1, as soon as the birth of a baby until 0 to 3 months, they start to cry when they get responded to loud sounds. And when a mother or father, they shooses down the kid with their voice, they tend to calm down. This is called startle reflex. This is number 1 test. Then between 3 to 5 months of age, when we point at a particular sound, some musical toy, they tend to move their eyes this side and that side.
Correct.
That is how this is other milestone. Between 5 months to 7 months, because the head holding capacity, everything comes. Though if there is a music which is playing, they tend to turn their head this side or that side. And from 7th to 12th month or 1 year, they start responding to their name. They start speaking monosyllable words, mamma, atta, amma, all this. By 1 year, they have to get these words. And from 1 year to 15 months of age, if we ask them, where is your nose? They tend to point at that. Get me the car keys. They go and get it. So these are the milestones. From 15 to 2 years of age, 24 months, they start speaking
Correct.
bisyllable words. If these milestones are not met, it is very important for parents to immediately consult an ENT surgeon.
Any kind of early intervention is better with the kids, correct?
Exactly. Early intervention is very, very crucial, and that awareness is not there in our country yet, because grandparents, they keep telling, no, you got your speech late, so your kid also gets speech late. Don't worry about it. They are basically consoling the parents. But in this generation where we have access to Google, access to doctors everywhere, parents are understanding that my child is not responding, milestones are not there. But grandparents trying to console them, they delay. And what happens when they delay? The child's brain is like a supercomputer. The hearing neurons, the neurons within the brain, they grow exponentially within 0 to 5 years of age. Think of a child's brain like a clay. When it is fresh, we can mold it in any direction, the shape we want. But as it hardens up over a period of time, we'll not be able to mold it. The same thing holds good for the child's brain. The hearing neurons and the auditory pathways, they grow exponentially between 0 to 5 years of age. We call this as neural plasticity. And this neural plasticity, it tends to go down as they age. That's why this window of opportunity, I can say between 1 to 3 years, is a very critical period. If you don't intervene a child who has hearing loss, severe hearing loss, at least with the help of hearing aids during this period, there will be significant speech delay. He'll not be able to communicate with his peers. He'll not be able to go to school. And if a child who is born with profound loss, there is no hearing at all, this child will be left as deaf and mute throughout his life, which has a very significant impact on the educational, on the emotional status, on the socio-economic status of the family.
Like we talked about the young kids. So shifting the focus to the elderly population, right? In my experience, at least because I don't do ENT that much, clinically, most of the times the elderly people come as a main complaint of hearing loss. And what they do is they try to increase the volume of the TV even to the maximum, right?
True.
Many people will say that, the TV is going to break, right? So that's one of the signs that they are not able to hear properly. So, but the initial thing is still hearing aids, correct?
Yes, sir. Rather than just increasing the TV volume, see, definitely they are grandparents. So they have grandkids and we are there to look after them. And we tend to shout at them unknowingly. We raise our volume. Till now, we were obedient all this. But because they are not able to hear well, we tend to shout and speak. And that emotions will be there on our face. We cannot raise our voice. That is when we ask them to start using hearing aid, start using an amplifying device. But they don't agree. Elderly people, they still have the social stigma of not using a hearing aid. They feel that it's odd to use. But we need to remember that as people become elderly, they become like kids. So we have to console them like kids, like how we explain to the kids. No, these are the things which you are facing. It's not just the TV volume. We are unable to talk to you and we do not want to raise our voice against you. Because of this, you are isolating yourself. Unknowingly, you go into a state of depression and finally leading to memory loss. We call this a dementia. This is very commonly seen in them. And we need to educate them. In fact, the newer hearing aids, what we are saying, it's not like something which is worn all the way. It's just like our Bluetooths. They can just play something here. That's why we'll ask them to take a hearing aid trial for about 3 to 4 days. We give them loaner hearing aids at our center. Use it. You'll feel the difference. That is when you come and take it. We have to behave like kids.
Wow. So your hospital gives a loaner hearing aids for 3-4 days. You try it out. Wow, that's a wonderful resource. That's very nice. So I can see that if that works, then they will be more compliant in the hearing aids. Both years or just 1 year?
Ideally, when there is blindness, as we tend to age, will we use glasses only for one eye or both eyes?
Both eyes.
Same thing. In hearing, 1 plus 1 is not equal to 2, is equal to 3. Because it has a squelching effect, the localization of the sound. If someone starts speaking from this side, they'll not be able to hear properly from this side. That is how our pinna is built. That's why we have the squelching effect in the brain to understand which side. And all this is possible when it is. But of course, sometimes financial issues, economic feasibility, and the compatibility of elderly people not using hearing aids, they may complain of pain. That's why we ask them to at least use one.
At least one, and then see how it goes. Beautiful, beautiful. So I'm just going to, my most pressing question is, what is your take on AirPods, which is the most fascinating thing out there now?
AirPods, I can say it's a kind of revolutionary product right now from Apple because it's mainly solving two crucial aspects. One, it is providing education about hearing health. And number 2, it is removing the social stigma of using a hearing aid. Because with the help of AirPods and a phone, we can literally do a hearing assessment at the comfort of our own home. You're sitting in our workplace. You can check how good is your hearing health. You've been to a concert yesterday and you feel there is some muffling, you can get your hearing test done
Through the earpods.
through the AirPods. And in case if you have some hearing loss, you visit a surgeon. Especially it is very much useful in elderly because they have the social stigma of not using a hearing aid. And now because their grandkids are using this AirPods, they don't hesitate using these AirPods as a hearing aid. So basically these AirPods, they're acting as a bridge between the consumer electronics and the professional medical electronics. It's just we are giving them an opportunity to get in. But of course, there are certain cons which are associated with this. This is only useful for mild to moderate hearing loss. In elderly people, they have severe hearing loss. So mild to moderate. And most importantly, the treatable options of hearing loss is not being addressed. It's being missed. For example, situations like otosclerosis. The only presenting complaint will be hearing loss. And a person just gets his hearing and he feels that, oh, I think the only option which I have is a hearing aid. But no, there is a surgical option. It hardly takes 20 minutes for surgery. And immediately on table, if I do like this, patient will be able to hear.
Tell me about the otosclerosis for my audience. I think in layman terms, in terms of how they can understand this.
Otosclerosis is a condition where the smallest bone in our body, the stapes, is fixed. Ideally, the bones are supposed to move. I told you the 3 bones in the middle ear. But what happens? The stapes is not moving. So the conductive apparatus is not working. Because the stapes is not moving, it cannot transfer the sounds to the inner ear. It is because of abnormal bony deposition in the stapes. Now, as a surgical procedure, we place a small hole in the, we call it as fenestra, within the non-mobile stapes, and we place a piston there so that it moves. The piston will be very tiny. The dimension will be 0.5 millimeter.
So you're dealing with like so teeny structures. Do you wear a Vision Pro or something like that, like a big macroscopic thing?
My eyes will be the microscope. That is how we tend to see that.
Wow. So this is called hearing restoration.
Complete restoration. So we need not wear anything like hearing aids or cochlear implants.
Wow.
It's completely. You can go in the rain, you can walk normally. In fact, this otosclerosis is something which is hereditary. I've operated for a son, for a 40-year-old person because he's not able to communicate properly in his office. And then because I operated on both his ears, he's quite comfortable. He got his mother to get her evaluation and I operated on them. And now his son's son, I operated on him also. All the 3 generations.
Because it's hereditary.
And this is such a fascinating thing because we call it as magic surgery. Immediately within 20 minutes, the patient will. But it requires extreme skill and equipment. I'm making a hole of size 0.4 millimeter. So any tremors in the hand, gone. Completely deaf. So that's why many surgeons, they don't do it. They just go for hearing aids. At least you have partial hearing. No? Go ahead with that.
Got it.
But we are known for that, hearing restoration surgeries.
Nice. Wow. I know, I could imagine the difficulty in restoring such a teeny thing. Wow. In elderly people, the other big thing is hypertension and diabetes can lead to hearing loss, right?
Yes, sir. Yes.
And how do you diagnose that same kind of evaluation where they will not be able to hear properly?
In diabetics, I always tell them to get a screening evaluation done at least once in 2 years because for them this hearing loss is just like a sunset. They don't feel the dimming of light minute by minute, but all of a sudden they feel it's dark. The same way, they don't understand that they are going through hearing loss because initially it's only the high frequency loss what diabetic individuals. For normal people to understand what this high frequency loss is, when a group of people are sitting and they are conversating, they'll be able to understand they're talking something, but the clarity of speech will be missing. Especially for sha, tha. If I say Shree, they can register only re. Sha sound is gone. That is how it goes on, especially and they have 2 times risk of developing hearing loss when compared to the normal ones. It's mainly because of multiple, you being the gut guru, you know how it works. Auditory neuropathy, diabetic neuropathy,
Correct. Yeah,
affects
yeah,
the
yeah,
nerves.
yeah. Just to summarize, we have discussed in the past as well, where the diabetes complication, the most important complication is damaging the nerves. And the nerves is supplying everything, the stomach, diabetic gastropathy, gastroparesis, the autonomic nervous system, every nervous. That's why they check eyes,
Yes.
diabetic retinopathy. So there is similarly, you also check your ears as well. Once a
Yeah.
year or once in 2 years?
Ideally once in 2 years, because if we say once in a year also, they don't come.
I see.
At least once in 2 years, please get. In case if they feel that it's getting too muffled, they only come and visit us. Hearing is such a humble organ; it doesn't require much attention, just like us wives. But if you don't address that little organ, it makes sure that you don't even sleep properly.
Like the
Tinnitus.
wives. Like the wives. Nice.
Just a little attention, annual screening,
Wow.
protection.
Yeah.
That's all.
So, as a very reputed inner ear cochlear implant surgeon, which is a very niche, how do you protect your ears?
As a hearing restoration surgeon, I tend to spend most of my time in OT, operation theatre. So I'll be exposed to various amounts of sounds, laminar flow, which produces somewhere around this 50 to 60
Correct.
decibels, HVAC, the suctions, the mastoidals. So I know that I'm using my precious time over there. I'm losing my precious time. So I make sure I enter into a calm zone.
You're losing your precious time of your hair
Save
cells.
time exposure.
Save time exposure to ears.
Save time exposure to the ears. And in the afternoon until evening, only a little bit of OPD and a normal conversation. That's all. No loud sounds. And I exercise every day. Not so long, but at least 20 minutes without any AirPods. Nothing. Calm zone once again. And yeah, having very good foods. I tell foods are like volume controls. So if you have more of exposure into loud sounds, a long consumption of alcohol, you're going to lose your hearing. So I make sure I do not take them at all. So this way, I feel most of the doctors, they follow the same routine. And me, especially into ENT, I have more of OT work.
Yeah.
So save time exposure, I'll make
Do you
sure.
use headphones at all?
Very rarely, because in the flight I was looking at your podcast, Gutman's podcast. So I had to use a proper noise cancelling headphone.
So you invest in a good noise cancellation headphones over the year.
Yes. And we also have some ear protection devices like earplugs and ear defenders. In fact, when they are buying certain things, especially for people who go for concerts or loud noise exposure areas, these ear protection devices, when you flip the cover of it, there will be something called NRR, noise reduction rate. Any NRR between 20 to 30 is very good. So if you don't want to listen to music or if you don't want to invest in such, make use of the protection devices, earplugs, ear defenders. They come, they passively block, and at the same time they have this active noise cancelling feature also in case if you want to use them. So buy them at least. They don't cost much, earplugs, hardly 10-20 rupees. You're exposing yourself for a good festival, just put that earplugs. 30 decibels, you're getting exposed to 100 decibels. 30 decibels, then and there it's cut. So 70, it's more or less okay.
More or less okay, yeah. So will that be applied to the, the movie theaters, the first day, first show?
Exactly.
Movie.
Exactly.
Right? Oh, that's a good thing. So ear defender is a device that goes over the ear.
Yeah. Here, this ear defenders, we can also call them as ear muffs, but I specifically didn't tell about ear muffs because when I told this to my patients, they started buying these villain ear muffs. And they said, Madam, I'm putting these ear muffs for my kid. But God, these are not the ear muffs. Ear muffs they just look like the headphones. And for them to understand, I quoted an example of Anushka Sharma and Ranbir Kapoor where they were in a concert, this breakup song. they wear that
Right.
big chunky pieces, right? They are the ear defenders. They passively block. And in case if they have active noise cancelling, so the noise will be completely reduced and the song, whichever you want to listen, you can enjoy.
Beautiful.
In case if you do not want to use that ear protection, take breaks.
Beautiful. Beautiful. Anushka and Ranbir are not talking to each other. They're doing dubbing. That's why. Wonderful, wonderful. So I'm going to tell you a very interesting situation. In one of my medical stand-up comedy shows, a person actually sent us a message that I absolutely love what you're doing on your channel. I want to come and see you. Do you have any sign language? Because I am deaf. That message really moved me. And any thoughts on that in terms of how these people actually can have a better life?
I can say there is a big deaf community which is very vibrant. Why am I stating this way? Because we just have one mode of communication, just this way. But they have different modes of communication. As you said, sign language interpreters through Indian Sign Language, through visual cues, through lip reading. The community is quite vibrant. And there is an article, a research which mentioned that certain hearing losses, when they are not treated, they lead into dementia. But there is a controversy in this because it was done in Johns Hopkins Institute where they researched about 639 adults over a period of 12 years. They stated that people who have mild hearing loss, they have chance of developing dementia 2 times, moderate 3 times risk of developing dementia. That is, memory loss. And people who have severe hearing loss, they have a very high risk of developing dementia almost 5 times more. But here, the thing that we need to remember is, it's not just hearing loss, it's untreated hearing loss or lack of communication. Because as you said, that young girl, Divya, she is completely deaf. She required a sign language interpreter. But she's quite good. She's able to remember you. All these years, she was completely deaf.
Right.
So I can say they are already leading their life.
Nice.
There is nothing much I can add to that.
Nice.
But what we need to remember that is communication is crucial, especially for the elderly people. They completely rely on this speaking issue. And if there is hearing loss and it is completely untreated with the help of hearing aids, if they are not using it and there is no one who is going and talking to them, that social isolation, that develops into dementia. Or else this vibrant community, you need not even think about it. They are extremely good, extremely intelligent. And sincere thanks to you, because this deaf community is something which many people do not touch, but you somehow reach to a level where even those people are very fond of you and they want to attend the Medcom shows.
Yeah, that was really
That
moved
is
me.
sincere thanks to you.
Oh, thank you. That really was emotional. She came to the show, and then after the show, we took pictures, and it was very nice. It was
I've seen that,
nice.
sir. It's so nice of you. I feel I'm a part of that community, hearing deaf community also.
Of course, you have made beautiful changes to them as well. So wonderful, super. I'm going to tell you a statement. Whether you need to tell us whether it's a myth or a fact. Okay, so first question: hearing loss only affects elderly people.
That's a myth.
It's a myth. It affects everybody.
Everybody, any age group, from the newborn to older age group.
Regular hearing tests are not required if you think you are able to hear properly.
No, even that's a myth. Because, as I said earlier, it's just like a sunset. You don't feel that your hearing is getting muffled until you completely lose it.
Even normal person should undergo hearing test?
Yes, sir. That's mandatory. Especially we are noticing this in age groups between 5 to 10 years old, because they already had hearing and now they are losing hearing because they are exposed to multiple sounds. It could be because of recurrent upper respiratory tract infection. In fact, very recently, there was an outbreak of mumps in India between December to March, April. And this mumps, when it was going off, it took off the hearing of kids, especially those age groups. That's why we say it is important to get.
Will those kids get better with the
No.
cochlear implant?
Yeah, definitely. Definitely. The only option is cochlear because they go into profound loss. And thanks to the tech devices, they were stating, Mama, I'm able to hear only one thing I'm not able to hear.
Wow.
That is how they are identifying and coming to us.
Wow. Beautiful. All right. Can oil drops cure ear infections?
Absolutely a myth. Oil drops will never cure infections. In fact, they worsen it. In case if there is a breach in the eardrum, those oil drops, they go inside and that cause middle ear infection, chronic discharge, hearing loss. Don't put anything in the ears.
My friend says don't use sunflower oil. I said that's good. He said use safflower. Okay. Hearing once lost cannot be restored.
I think
Both.
both. Because I myself being a hearing restoration surgeon, there are two components in this, a conductive and a sensory neuron. All the conductive parts, they can completely be restored, that hearing part. But the inner ear, the hair cell part, that is the neural component, those cannot be restored, like noise-induced hearing loss. The ones which are through viral infections, the one which Alka Yagnik had, they cannot be restored. They have to be supplemented with a hearing aid or a cochlear implant.
Wow. Nice. Ear cleaning is necessary like a dental cleaning.
Definitely.
Myth.
There are only 3 times that we need to do an ear cleaning. One, when your hearing is muffled because of the earwax. Number 2, you start getting pain because of the earwax. Or number 3, a hearing surgeon like me needs to look into the eardrum, what's happening inside. Other than these 3 things, there is no need to clear wax or clear your ears. In fact, that is protective. It prevents any microorganisms entry because it has a particular pH and it is designed in that way.
Using earbuds is good for you. It's a myth.
In fact, when you flip the cover of the earbuds, it is very clearly written on that, please do not use inside the ear. It's only for the outer crevices. That's all. You're not supposed to stick anything because once you start doing that, there is a conveyor belt mechanism inside our ear. It's inbuilt. It always makes sure that the dirt or wax, whichever is there, it is shedded out. That is called shedding of epithelium. That's nothing but wax. But in case if you are using these Q-tips or earbuds, you are disrupting that and you are creating micro abrasions. Microscopically, we can see that. And that causes infections.
Infection.
And you are disrupting that conveyor belt mechanism. The natural cleaning mechanism is gone and your earwax gets stuck.
So people think that using earbuds can actually clean your ear, but can actually increase the risk of ear infections.
Exactly.
So if you have a cold and if you are taking a flight, that will damage your hearing permanently.
No,
Myth.
that's a myth. Because there will be a tube which connects from nose to the ear. That's called eustachian tube. The main function of this tube is to equalize the pressure, the outer atmospheric pressure to the middle ear pressure. It equalizes. But what happens when we take a flight travel? Because of rapid changes in the cabin pressure, it takes time for this eustachian tube to function. But it will function, like when you yawn or when you take a sip of water, when you gulp. But during upper respiratory tract infections like cold, the eustachian tube gets blocked because of this cold inflammation which sets in. That's why it will not be able to equalize the pressure. That's when people start getting pain because infection is spreading from the nose to the ear. Understand? That is when they start getting pain or muffled hearing, all this. And most of the time we would have seen in the flights, as soon as there is ascent and descent, kids, they start crying.
Yes.
Rather than when it is flying normally.
Yes.
The reason is for kids, this eustachian tube, the tube, it's much smaller, much narrower, and the angulation is not there. It's horizontal like this. As our face expands, this comes down this way. So it is like this. The capacity to equalize the pressure will not be there that time. And that's when they start crying.
Nice. I mean, that's not nice for the kid, but I mean, beautiful explanation. All right, so rapid fire questions, okay? The most dangerous myth you encounter every day that you wish you could change.
Most of the grandparents, they tend to console their kids stating that don't worry if your child is not getting his speech. You took time to get your speech. You spoke after 5 or 6 years. Wait and watch. He starts speaking. That is a dangerous thing because neural plasticity is gone. He'll not be able to hear properly throughout their life.
So it's better to have an early diagnosis
Intervention.
and checkup. Got it. One hearing health habit that you think everyone should adopt.
Stop using Q-tips or earbuds.
Okay. Biggest threat to hearing in modern India with all these devices.
Noise-induced hearing loss.
Headphones.
Headphones usage.
Most promising advancement in hearing loss.
Cochlear implants.
Cochlear implants. Beautiful. So the last one is here is 3 simple steps every Indian can take today for better hearing health. Basically summarizing our podcast.
For all the IT people, for all the software engineers, make sure you follow a 60-60 rule and invest in good quality headsets. Protect your hearing because once your hearing is lost through noise-induced hearing, there is no way that we are going to restore.
There is no medication.
There is no medication and we are not able to restore it. Please spread the awareness that hearing loss, when identified early, is treatable.
Treatable. Yeah. And also I wanted to bring it to my audience, the wonderful work that you're doing, where you are actually giving the cochlear implants to underprivileged people, where they will not be able to afford this much amount of an cost. So that really I was pleasantly surprised that, there are hospitals who are actually promoting this in a very good way. And you are one of the top surgeons. And if you are spending your time for underprivileged, that is something that is really, really appreciative of what you're doing. And thank you so much for doing that. So can you tell us what is the general cost involved and how a person can actually reach out to Dr. Rao's hospital in terms of if they ever find any hearing loss in kids or anything like that?
The cost of a cochlear implant ranges between 8 lakhs to 20 lakhs.
Wow.
I myself, as a cochlear implant surgeon, as a hearing restoration surgeon, I feel privileged that I have performed the maximum number of implants till date. And through our Rao's ENT cochlear implant program, we are conducting these hearing surgeries free of cost.
Wow.
For kids who are born deaf and the underprivileged kids under the age of 5 years. So in case if your loved ones or people who are working with you, if they do not know that early intervention is required, please create the awareness that once they are addressed with the help of this cochlear implant surgery or hearing, where we are addressing their hearing, you're protecting their life. The child will come out from the zone of being deaf. So in case if any of your colleagues are there or any of the kids that you know are there, please let them contact our hospital. And thanks to the NGOs, non-government organizations that are helping us with the amount of good work that we are doing. They are sponsoring us, not just with the implant, but also the surgery of the implant is also being covered.
Nice. I wish this message reaches to many people because, sponsoring is a different thing, but the actual person to do it by giving your time, that is also a very important, equally appreciable thing. So both the factors are available in your hospital. I hope everybody make use of this opportunity and we could create a better India with deaf-free India, as you say, right? That's your mission.
Yes, sir.
Right?
Yes.
So I hope Dr. Shree makes that statement very well. And I wish nothing but good luck in all your endeavors. And thank you so much for your time.
Thank you so much, sir.
Thank
Thank
you.
you.
That was a wonderful episode. I absolutely loved it. She is an absolutely amazing person. You could see that, simple steps can prevent our hearing loss. And number 2, most importantly, if you know anybody with hearing loss, okay, so tell them that hearing aid is not the only option. There are other options available, including cochlear implant, which could potentially change the way that they look. And I'm sure you will be conscious of how you're using your headphones, how much amount of decibels that you are being exposed to on a daily basis. Remember, those 4,000 hair cells that she talked about in the inner ear is absolutely critical for you to save for the rest of your life. All right. As usual, stay happy, stay gutsy. May gut bless you.